Hi, I'm Dr. Faber, and I wanted to discuss the medication treatments for anxiety in children, adolescents, and adults. In general, these categories of medications include the serotonin reuptake inhibitors, so medications such as Prozac, Zoloft, Celexa, Lexapro, Paxil, Leuvox. A second type of medication is called Buspar or buspirone. And then the third category includes what we refer to as the benzodiazepine medications. These medications include Xanax, Klonopin, Valium. Now, in general, with children and adolescents, we are not in a big hurry to consider the use of the benzodiazepines. These medications will decrease anxiety and, if used, should be considered very short-term because they can also cause disinhibition in younger people. So we're very cautious in their use, and generally teens with, let's say, severe panic disorder or intense separation anxiety in younger kids or excessive worry, we might consider maybe very, very low dose Klonopin or maybe Xanax. Ativan is another type of benzodiazepine. But as I said, this category of medication is used very conservatively in young people. In adults, it's not unusual to consider the use of either Klonopin, Ativan, or maybe Xanax for brief use until a secondary medication begins to work. So it would not be unusual to give a benzodiazepine medicine with a serotonin reuptake inhibitor, and as the SSRI begins to take effect, usually within 2 to 6 weeks, then the benzodiazepine can be lowered and discontinued. Now, in regard to the SSRIs, they are multiple types. They include Lexapro, which is among the newer of the SSRIs. Lexapro has a dose range generally 10 to 20 milligrams in adults, lower dose range to start in younger people. It's FDA approved age 12 and above. Lexapro may cause some sleepiness or fatigue, and so considering giving Lexapro in the evening would not be unusual. The second would be Prozac. Prozac is FDA approved in children as young as age 7 and has been used to treat OCD and even depression. Prozac has a longer duration than a medication like Lexapro. And it does not typically cause fatigue. It's generally given in the morning, and it may even cause a little bit of activation or increased energy. Next is Zoloft, and Zoloft is FDA approved to be given as young as age 6 for OCD and is used in older kids and adults for anxiety and depression. And Zoloft has a little more stomach upset, a little more of the GI side effects than the other SSRIs. Then we have Paxil, which we don't tend to use with children, but may be used in adults. Paxil tends to cause more sleepiness, more weight gain. It has a very short duration of action and a lot of drug interaction too. And then there is Leuvox, which is used primarily for OCD and has been used in children, adolescents, and adults. It has a fair amount of drug-to-drug interaction as well and a broad dose range. So these are the SSRIs. What they share in terms of side effects early on are headache, stomach upset, a little extra energy, maybe some sleep-related difficulties. They differ based on drug interaction, so Paxil and Prozac have more drug interaction, and duration of action or half-life. Paxil has a very short half-life, Prozac has a very long half-life, Zoloft and Lexapro and Celexa are more intermediate in their half-lives. And so the SSRIs can be used, and indeed have often been used, along with cognitive behavioral therapy to treat the various types of anxiety, whether it be social anxiety, generalized anxiety, panic disorder, or OCD. Now, Buspar is neither a benzodiazepine nor an SSRI. Buspar or buspirone is FDA approved for treating generalized anxiety disorder. So for a person who tends to dwell or feel tense, on edge, headaches, stomach aches, Buspar may be effective. Buspar can also be added to an SSRI to potentially increase the effectiveness of the SSRI, for example, with OCD or generalized anxiety, or in fact in the treatment of depression. So Buspar does have a restricted but a possible role. And so the anti-anxiety type medications are the SSRIs, Buspar, and the benzodiazepines. Thank you.